hygiene, walking in the room. Hey, how you doing today? Do you related to the patient? My name's Jared, I'll be your nurse today. We're doing a physical assessment.
Hi, Jared.
Okay, can I see your wristband, please? What's your name and date of birth?
Lear Didi, 1986.
Okay. Do you know where you're at?
I'm in the hospital.
Do you know what month it is?
November.
Do you know what we're doing?
Physical assessment.
And do you know who the president is?
Biden.
Okay. Orient, and all 4 times Orient. Do you have any allergies or anything?
Bactrim.
Bactrim, what does Bactrim do to you when you take it?
Vomiting.
Vomiting? Let me check your wristband real quick. Okay. The wristband, she has her allergy bracelet on. Are you in any pain today?
I am not.
Okay. And next thing we're gonna do is a general inspection of the face, of the expression. Everything seems to be fine. Okay, pink, dry, and intact. Perfusion is good, noted. Okay, client is oriented and coherent. Okay, we're gonna go over your vital signs now.
Okay.
So we did your vital signs and they were 120/80. O2 was 99%. And your pulse rate was 75, which is all in normal ranges. No interventions, we're just gonna check it again in a year when you come back. So right now your vital signs look pretty good. Okay, now we're not gonna use any, there's no tubes or equipment being used today, but I'm gonna scan the room for safety. I'm gonna raise the bed to the waist level. I'm gonna make sure my side rails closest to me is down and the side rail to the back is up for the client's safety. Okay. Next thing we're gonna do is we're gonna go over the head and sensory assessment. Do you have like a history of any vision problems? A history of any hearing problems? And a history of any kind of difficulty swallowing or anything?
Nope.
Okay, so first we're gonna check your facial symmetry. Symmetry is noted, symmetrical. We're looking at the facial expression. The facial expression is relaxed. We're gonna look into your mouth here. All I want you to do is say, It's pink, moist, and intact. I'm gonna check your teeth now. Thank you. Present, intact. Now we're gonna do an eye test here. Okay, so we're gonna follow the pen light all the way to your nose. Keep your eyes on it, keep your eyes on it, keep your eyes on it, all the way to the nose. Awesome. Now we're just gonna keep your eyes. Good. All right, now I'm gonna check with the light. Make sure you're looking at something on the wall here.
Okay.
Okay, thank you. Perfect. Perfect. Pupils are equal, rounded, reactive to light, and accommodated. 2 millimeters on both sides, the eyes are equal. Now I'm going to work down to the chest through a chest inspection here. Okay, so we're going to ask a couple questions about your history. So do you have like a history of any kind of chest pain? A history of any smoking? Okay, a history of any kind of like chronic illnesses for respiratory?
No.
Okay, all right, and any kind of like breathing issues, shortness of breath?
No.
Okay, okay. Just gonna check your chest out, make sure, just breathe normally. Okay, it's unlabored breathing, no respiratory distress. Now the next thing we're gonna do here, I'm gonna auscultate to go to the Erb's point. All right, it's gonna check here. All right, I checked the Erb's point, and there's no, the rate seems regular rate and rhythm. No murmurs, and check the S1 and S2. Also, the lub and dub sound good. Okay, now next we're gonna check your respiratory, so we're gonna check your anterior lobes on your lungs. Just breathe in and breathe out. Good. Breathe in and breathe out. Good. We're gonna check the lateral lobes now. Check the lateral lobes over here. All right. All right, just breathe in and breathe out. Thank you. no aphasious sounds, no murmur, no stridor or wheezing or crackles, which it sounds good. Now we're gonna check for any kind of for skin turgor. So I'm actually gonna pinch your skin here. Thank you. I'm gonna grab a little skin here, make sure it goes back. Skin is no tenting, skin supple, so you're looking good there. Now we're gonna work all the way down to your abdomen here. So you're gonna lay down for me. Thank you. Okay, it's gonna bring it up here. I'm gonna ask for a few questions first and bring it up to say that. Thank you. And when's your last void?
This morning.
When was your last bowel movement?
This morning also.
This morning also. Let's see. Do you have any more issues with abdominal?
No, I don't have any abdominal issues.
Okay. Okay. How about your diet?
I eat mostly the Mediterranean diet.
And how about your appetite?
I'd say it's normal.
All right. Any nausea or vomiting?
No, nothing
Okay,
like
okay.
that.
So what I'm gonna do now is I'm gonna auscultate here. I'm gonna use my stethoscope. I'm gonna check all 4 quadrants to see if the bowel sounds are normal. Normal active bowel sounds in all 4 quadrants. Okay, I'm gonna bring it back up. I'm gonna palpate.
sorry.
You're good. Just gonna palpate here. I'm gonna check for any distensions, lesions, edema, contour to make sure there's no shapes, different type of shapes. Everything is good. So no lesions, no edema, no distensions. Was there any pain there when I was pushing it?
No.
Okay, so no good. No tenderness, non-tender. Okay. Let's see here. We're all done with that. You can sit all the way up now. Thank you. Now we're going to check your upper extremities, which is your arms. Okay. So come in here. It's going to look at your arm. Can you put it out just like that? No, it's just kind of on the ground. There you go. Skin looks. I'm going to touch with the back of my hand. Check the temperature. It's warm, dry, intact, pink. No edema. No lesions, no wounds, anything there. Okay. All right. So we're gonna check next. Let's see here. Do you have a history of any numbness in your hands?
No.
Do you have a history of like any tingling?
Nope.
A history of any kind of weakness
No.
or any joint pain? Good, good, good. Okay, so I'm gonna get your pulse here. I'm gonna check your radial pulse bilaterally on both sides. Right here by your thumb side. Got a strong pulse today. All right, check the other side. Radial pulse is 2+ bilaterally, so we're good there. Now I'm gonna check your nails. No clubbing noted. We're going to check for capillary refill on all fingers. Capillary refill is less than 3 seconds. Okay. All right, now we're going to go to your lower extremities if you want to lay down for me. Just going to check your ankles for edema. There's no lesions. Thing looks good. There's no swelling there. Okay. We're going to go all the way down to we're going to check your pulses. Pulse, pedal pulse. Pedal pulse is 2+ bilaterally. Do you also have any like numbness or tingling,
No, nothing like
weakness,
that. No.
or okay. Any joint pain also in your lower extremities?
No.
Okay, gotcha. Okay, we're going to check your capillary refill on your toes. Check all your toes here. Everything's less than 3 seconds, so we're looking good there. Skin's moist, pink, and intact. And skin's warm. I check the temperature. Okay, we're going to sit all the way up. All right. Now what I want you to do is I want you to put your legs out. I want you to press here. Whoa, you're strong. Okay, so let's push me over. All right, so opposing forces are strong. 5 out of 5. Now we're gonna get on your stomach here. We're gonna check the backside, posterior, for skin integrity. warm, moist, intact. Let's see. We're gonna check your pressure point here. This is your ischial tuberosity. I'm gonna push it. Do you feel any like? Does it feel tender or does it have any pain?
No, not
No,
really.
no pain. We're gonna also go to the sacrum here where the pressure point is. Any pain? Any tenderness?
No.
No lesions. No edema. Okay. All right. I want you to sit all the way up. Okay. So we're done with the assessment, and I just wanted to kind of go over a few things with you. You're pretty healthy. Assessment went pretty good. Do you have any issues or do you want to talk about anything? Okay, there's going to be no rounds or no medical help or no medication. We did draw blood, so we'll get laboratory results when we get the blood results back, so we can see if there's any issues. But that's all I got for you today.
Okay,
All
thank
right,
you.
thank you.